You can kneel again after knee replacement. A lot of people worry that they'll damage the implant, but you can't. The parts are very solidly fixed to your bone. What you will notice is that it's going to feel a little bit strange and different than before your surgery. And that's because a few things have changed. Firstly, you have now either your kneecap against the metal component or the plastic button behind your kneecap against the component. And during surgery, we cut the tips of the sensory nerves that run across the front of your knee, so it never feels quite the same again. But all of that is completely normal and nothing to worry about. And as long as you understand that ahead of time, most people can absolutely get back to kneeling, or at least much closer to it. In fact, a 2019 study showed that almost all patients who followed a simple progression were able to get back to kneeling successfully. It only takes a few weeks and anybody can do it. All right, here's how we're going to get you back kneeling after your knee replacement. It's a very simple progression that gets your knee used to the feeling of being kneeled on again. It's going to be a series of phases, and each phase you're going to do for 1 week at a time. Once your knee feels used to one phase, you're going to move on to the next. If it takes longer than a week, that's okay too. Phase 1 is kneeling on a couch. Ideally, you want a very well-padded couch that's going to be very gentle on your knee. If you need to, you can even put a cushion on the couch as well. But all you're going to do is stand here next to the couch, and just while you're standing, gently lean on your knee and get it used to the feeling of pressure on it. And as the week goes on, you can slowly put more and more pressure on it until the knee feels like it's used to this sensation. Phase 2 is to stick with the couch, but also now actually put all your weight on your knees. So now instead of standing and gently putting weight, you're actually going to get on both knees and kneel on the couch. Let them experience that sensation. Take about a week to get used to this phase. Phase 3 is now moving down to a well-padded cushion on the floor. Put the cushions down, and similar to how you did with the couch, begin by just kneeling gently on that one leg and using your other leg for support. Just kind of get it used to that sensation of kneeling. When this feels good, you again can progress to both knees on the pillows, giving full force on that knee. This one is a bit of a tough adjustment for most people, so make sure that you get used to it before you move on. The next phase is to progress to a blanket or other small padded item on the floor. Same as before, first thing, get down on your knee using the other knee for support, and when you feel comfortable with that, both knees on the blanket, and you're almost there. And finally, when you feel ready, get down on the regular floor. First on just your one knee supported, and then finally on both knees. And if you do this in sequence, slowly and surely, you should be able to get back to kneeling, or at least very close to it. I hope that was helpful and gets you back kneeling the way you want to after your knee replacement. My goal is to make your recovery after knee replacement and hip replacement as easy as possible.